Chapter 23 talks about arrhythmia and antiarrhythmic drugs. So arrhythmias are caused by electrolyte disturbances and overstimulation of the heart, and they can originate anywhere in the heart. The most common types are tachycardias, premature contractions, flutters, and fibrillations. Arrhythmias that originate in the atria and atrioventricular nodal areas are referred to as supraventricular arrhythmias, or above the ventricles. Paroxysmal atrial tachycardia, atrial flutter, and atrial fibrillation are common supraventricular arrhythmias. Arrhythmias that originate below the AV node are referred to as ventricular arrhythmias. Ectopic foci, areas of abnormal impulse generation, may appear when electrical impulses traveling through the conduction systems are delayed or blocked. Ectopic foci that originate in the atria are referred to as premature atrial contractions, or PACs. PAC would be classified as a supraventricular arrhythmia. Ectopic foci that originate in the ventricles are referred to as premature ventricular contractions, or PVCs, and those are, of course, ventricular contractions. Abnormalities in ECG waves are how we know there's a problem. They indicate a conduction malfunction. So people who are trained look at EKGs or ECGs and can identify normal or not normal, and exactly what not normal type of thing is going on. So specifically, we're talking about PQRST waves, which is the complete contraction and relaxation of the heart. So if they're not within normal limits, or if they take longer or shorter than they should, that's how we know we have something wrong. One of the most important aspects of the heart is the function of several ions that regulate the electrophysiological properties of the heart. That is the sodium, potassium, and calcium ions. Sodium and potassium are related to conduction, whereas calcium is related to contraction of the muscle. Ventricular muscle does not normally display automaticity. However, it can develop automaticity when there is ischemia, excessive sympathetic stimulation, or other abnormal conditions. And when this occurs, ventricular muscle can depolarize and generate a premature ventricular contraction, or PVC.